Well, good evening, everyone. This is Dr. Ellithorpe, and I'm with Tustin Longevity here in Southern California. And we come every Tuesday at 6 p.m. Till 7 p.m. We're a group of functional medicine doctors who are trying to provide our patients, our families, our friends, and interested people with a venue to come and ask about how would a functional doctor approach any topic? So we may not have all the answers, but it will give you our thoughts about how we approach this. I've got about 45 years of experience. My father was in food research, so I was kind of born to do this kind of work. And we meet here every Tuesday, so you can type in your question. We have a TLC doctors.com, tlcdoctors.com website, and you can join our newsletter, and then we'll send you notifications, and you'll get a link for information about when our next Tuesday is coming, just to confirm it. And there you can type in your question, limited to a certain number of characters. And then another way you can do it is you can type in live if you're on YouTube. You can get to the live chat here and type in a live question, and then we'll be happy to try and answer those. Again, I may not have all the answers, but I'll certainly give you some of my thoughts, and maybe sometimes I can look something up and have a response within the next week or two, so you can do that. Let's see. We have some questions. I didn't see any new questions come in this week, but we're starting to get some new questions in the live chat here. So I'll go to that first. And that's from Tiziana. Hi, I hope you had a good Thanksgiving and have a Merry Christmas upcoming here. But she says, hi, Dr. E. What should a patient do if they experience severe diarrhea for 2 days post chelation therapy? Should they continue to do the IV regardless? Thank you. Well, I would be amazed that it's linked with chelation, because the EDTA is probably, the half life is maybe 6 to 8 hours. It's out of you, and the um, the nutrients are probably taken up immediately. So, I'd have to get a history on that. It's likely that you, or whoever this is in reference to, have a separate cause for the diarrhea for 2 days. My experience over more than 45 years and having taught this and been with physicians and lecture halls with clinicians and doctors for many decades, I have never seen diarrhea linked with a after IV chelation. So that's my experience. I'm not saying nothing's impossible, because we're all unique, but I would say that's not to be expected, and it's probably a coincidence or a correlation that you were just coming down with something anyway. If you ever have diarrhea, the answer to that is to rest your gut for at least 24 to 48 hours on a clear liquid diet. We tell people to use chicken broth and uh, chicken broth or beef broth, and rest the gut, just getting all the electrolytes and fluid. And that way, we ask them to take ginger ale, mix it with water to get the fizz out, and that'll give some energy, glucose with regular ginger ale. So that's usually, and if that doesn't clear it up within a couple of days, you should be seen by your doctor. All right, so Tiziana said it was not herself, a mutual patient with autoimmune issues. Well, I would say most of the patients have autoimmune issues today because of our leaky gut and the damage to our gut from the corruption of our food and farming and the chemtrails. So, absolutely no, this was something else outside of, in my experience, anything with chelation therapy, because I have decades and decades worth, and I've never seen that, nor have I ever seen doctors discuss it. So, and then she sends her heart and love and says, thank you. Thank you, Tiziana. Well, I certainly hope whoever this is gets resolution and or calls. Let us know. If she was here getting her chelation here, let us know. Okay. Um, Let's go to some of the written questions. We have a email question from Vivian. Vivian says, "My friend and I are your patients, okay, and he is continuing to experience headaches and has seen a cardiologist you recommended, but there's no answers yet, I guess, to his headaches. He also has trouble with intermittent fasting and discussed with our nurse Terry here because food doesn't digest properly after his first meal going through him. What should he do?" Well, I guess, Vivian, this is just too limited a piece of information. What is he eating? How old is he? What is his blood type? When was his last colonoscopy? Did he ever do a complete digestive stool analysis? Has he ever done immunoglobulin G, IgG, food allergies? Has he done any skin allergy, IgE type testing for allergens and food allergies? Um, how late does he eat at night? Um, and what are his chemistries for his insulin, hemoglobin, triglycerides, and I mean hemoglobin A1C and fasting insulin. So there are just too many questions I would have to ask. He needs to be seen and discussed with his doctor and go over these various aspects and address it from that type of a workup. Regarding headaches, if he has seen a cardiologist or was referred to one, could it be that it was high blood pressure giving him a headache? I mean, this is just too scattered of pieces of information for me to come with any one answer. So have him see the doctor, whether it was me or whoever it was, and let us refresh our ideas and memories about where he's at and what he's experiencing, and try and help this dear man. Vivian had another question, and she said, "I woke up today experiencing a fourth diverticulitis flare up this year. Okay, and what is your standard protocol? I fasted for 48 hours, but after my first meal, pain is worse than when it started." Now, this was from before Thanksgiving, November 25th. This question came in last week that I wasn't able to get to. So, Vivian, if you have a recurring abdominal pain, and I think I know who you are, and I think the last time you went on a 24 to 48 hour clear liquid fast, meaning the chicken broth, the beef broth, and using ginger ale mixed with water, um, and rested for 1 to 2 days. And again, if that is not bringing you relief, or if you develop worsening symptoms, or there's blood in the stool, or pain with urination, or fever, or chills, or vomiting, you need to go and be seen by the doctor or urgent care. So, if there's any protocol that we have, it would be anytime you get sick, I stop eating. I don't care what my problem is. I recommend stop eating so that all your immune system can be focused on what the problem is rather than trying to sort out the safety and function of breaking down and utilizing your food. To eat is to put your body to work. So I rest my gut for a day or two whenever I get sick, no matter what the cause, but definitely if there were diarrhea. Um, the food system today is so corrupted, and uh, God only knows how much immune harm has happened after certain injections of the mRNA messing with the immune system response. So we have lots of new challenges with that, unfortunately, to deal with as doctors. So we have to know the blood type. We have to know at the time of eating. We have to look at the food reactivities. We have to look at a complete digestive stool analysis and review those things and give you our best recommendations. The more simple your diet, the more mundane it is what you're eating, and you eat simplistically and only have wild treat days like a Thanksgiving dinner, then a month later a Christmas dinner, and then a New Year's, and then a Valentine, then Resurrection Sunday, and then Memorial, and then in other words, if you have these treat days and less of this food variety, just because we can afford it and it's marketed to us, we shouldn't be challenging our gut. And I think that our gut is just fighting us back and saying, too much. You're asking too much work out of me. And it fails us. Remember, 80% of your immune system is lining your gut because God wants to screen the food for bacteria, fungi, uh, viruses, parasites, worms, nematodes, all these kind of things that can get into a food. And so it's put through a extreme immune screening, and you're supposed to secrete enough acid and enough digestive enzymes to be able to break down the fats, and the proteins and the carbohydrates are usually not as hard to do. And the older we all get, this becomes more difficult to do because we secrete less enzymes, less acids. And so the food is harder to digest. It sits in our gut too long. It can create more fermentation and overgrowth time and gas production. And so eating less variety, eating a more simplistic diet, and ending your meals, like mid-afternoon. If you're over 60 years old, ending around 3 in the afternoon is probably the best thing to do as you're getting older. And then always consider a digestive enzyme that has betaine hydrochloric acid and digestive enzymes for proteases to break down protein, lipases to break down fat, and amylases to break up the sugars. So I would have to say, talk with your GI doctor. If this is recurring, we would want you to have a second person watch over your gastroenterologist if needed to have some scoping done. The other thing is, as we get older, the tube that is our gut, the elastin collagen outpouches, it'll outpouch as these nipples because the elastin collagen, we're not getting enough protein in our diet to repair the walls of our body. Our skin gets wigglier as we get older. Our colon gets wigglier, so to say, and outpouches as we don't make tight elastin. It becomes outpouched like that. And you need enough vitamin C. You need zinc. You need uh, uh, a diet rich in protein, and we're being pushed to be eating plants and plant proteins that are not the best for our amino acids and our protein requirements. So I would say, Vivian, let me see you. I don't know when our follow up is, but if this is recurring, we have to look at that and maybe update some of the studies we've done on you. Let's see. We have a patient by the name of Jennifer. She asks, you often refer to blood types for health and nutrition. What can you refer me to for further knowledge to learn? I read the book Eat Right for Your Blood Type by D. Adamo, D apostrophe Adamo, second word, when it was first published back in the 90s, but your references to this topic don't seem to be from it. Thank you for your help. Well, that's because I did a second doctorate in 1999, 2000, 2001. And in this period of time, we had clinicians, doctors from all over the world, from Eastern medicine to European medicine, come to Washington, D.C., where Capital University was located. And I picked up from their lectures and their conversations that the blood type has a tremendous impact on your immune system because of the unique um, uh, histocompatibility markers on the outside of the red blood cells from your blood type. And that is so important to define how you're going to approach uh, uh, other things in your body and or have a attack versus being friendly. So if I gave someone blood from the wrong blood type, I could kill them because the markers on one cell would have different immune complex docking sites and identification than another. And if they don't meet compatibly, then I would make antibodies to kill off the invading red blood cells. So there is such a tremendous immune response to the presence of a foreign blood that could put you into hemolysis and coagulation problems, that it is by definition a very important feature of who you are. That's why I think it should be on your vital signs, like your blood pressure, your weight, your temperature, your respirations, your oxygen saturation, and your blood type should be there, so that we can understand and see patterns in people, O type blood people, over more than 45 years of my practicing medicine. They are the people that get osteoarthritis in such a bad expression, and they're particularly triggered by the grains that have been genetically modified with this new dwarf wheat that we gave the Nobel Prize for the guy who genetically changed the wheat plant to the dwarf wheat to give more weight per hectare and save the world from starving. I think it was in 1955 this Nobel Prize was given. Anyway, that genetic modification has created tremendous immune surveillance irritation to the O type blood. Now it does to the B and the AB and the A's, but the O's seem to have the worst reaction to genetically modified grains, and they get worse arthritis. And how do I know this? Well, I learned it during the many different clinicians who talked to us from around the world at Capital University in the 1990s when I did the second doctorate. And over all the years, I have seen it borne out. I have seen, I said, "What is your blood type?" And they're coming in with their osteoarthritis and stuff. And I'll go, "Wow, that really does pan out." And so now it's a feature of my managing my patients. And what is it for the A's? A's don't digest well their foods. They don't make enough stomach acid and enough digestive enzymes. So they can't make B intrinsic factor for their B12 and other B vitamins. And so they have the B deficiencies in energy, and they get all these maldigestive subclinical symptoms, and they become anxious people. And so it's always in the A type person I see this as a general rule. And then the Bs tend to have the worst allergies, lots and lots of uh, sneezing, allergies, asthma, things like that. And AB type blood is just a combination of both the A and the B type blood symptoms. So that's what I found on the blood type. So there isn't something to refer to it um, as far as the scientific thing, and I don't have the money or the wherewithal to insist that all the orthopedic doctors get blood types and see the degree of osteoarthritis in all their O type patients versus B versus AB versus A's. So there's just so many simple, very valuable things that we could do. But since we have captured our country with captured pharmaceutical lobbying interests for pharmaceuticals, and they dictate all the research to build up their lousy businesses instead of letting real doctors that do not have any financial commitment uh, but have valid and clinical histories worth decades of experience. These are the doctors that should be on panels that are allowed to speak to the local population or the state population and say, let's do a study on ABC. And if we can get enough to see that, then put some simple money into some very simple things that can maybe give tremendous weight that will eventually bring change into the impact of this horrible uh, grain industry and lobbyists that are hurting us with our dietary recommendations and cereals, and they control all the dictums for what a hospital will eat, what school systems will serve, what the military will serve, what prisons will serve. All these and more recommendations are advised by the American Dietary Council, and their board is just full of paid off lackeys who have financial interest to these groups that are going to endorse all this foolishness in bad food recommendations that is harming us. So that's what I think about the blood type question. Then Donna says, my hairdresser has had consistently low iron levels, and the iron supplements her doctor prescribed constipate her. So she takes laxatives every day to relieve the constipation. However, she's worried about relying on laxatives. Any suggestions? Yeah, Donna, I would have her find a functional doctor and then get her blood type. If she's a blood type A, she's just not digesting her food well. She not only can get the iron out of her food, but A's as a class, since it's hard to digest proteins and fats, they tend to move away from eating much protein, and they become usually more of a vegetarian or vegan, and they are missing these minerals. And then the more they eat the legumes and vegetables, which are rich in ligands that take up the minerals that may or may not be in the food, meaning the plant will hold on to minerals because plants are designed to hold on to minerals to grow. So you might be eating something, but you take plants with it. And if you have a little chicken or a little fish or a little turkey or meat or eggs, and there's minerals in it, those plants are designed to chelate, grab onto minerals. So the A type blood is in a worse situation, and the plants are stealing your minerals. And this has been well studied. One of the worst is corn. Genetically modified corn, maize, has been destroyed in this country. It's making generations of people who characteristically use a lot of corn in their ethnic eating. Overweight, hyperinsulinemic, hypertensive, diabetic type people, because they are eating this maize corn in various wraps and tortillas and so forth, and it takes the zinc out, and so they get illnesses and colds and immune system problems. They lose their copper, their iron, and all this, and this just has to be understood and taught to doctors. Otherwise, we're just treating symptoms. So we have to find out what this her blood type is and find out why she's not absorbing her iron and having anemias. And does she have heavy menstrual cycles, or how old is she? Does she have an endoscopy, colonoscopy? Does she have bowel absorption problems? Does she have gluten sensitivity or non-Crohn's? There's you can have the wheat sensitivity, and then there's such a thing called as a non-wheat sensitivity type food allergies to grains. So there are many things that have to be worked up on this dear patient. So we can't just throw prescriptions at people, take their insurance money, and say, well done, clinician. No, you have to try and help them and not solve it with another laxative or something. Find out how much water they're drinking. Find out how much exercise they're doing. Are they thin? Are they obese? Are they a thin person who's fat on the inside? They may be by pound and outside appearance thin, but they may have a lot of fatty visceral fat and so forth. So there's so many things to have to be answered there first. Then the next question is from Sally, and Sally says, thank you for recently explaining macrocytosis. Macrocytosis is on a blood count where macro means big, the macro, large red blood cell. Microcytosis is a tiny red blood cell. There's a Mediterranean genetic trend called thalassemia minor, and this is a type of genetic lineage of humans that tend to just make smaller red blood cells. Whereas macrocytosis usually is defined as a vitamin B12 anemia, pernicious anemia. So the cells get bigger and bigger, your bone marrows are not making as good sized, healthy a cell as it used to when you were younger. It happens to all of us as we age because our digestion gets poorer and our need for B vitamins increases as we have more aged cells and need for repair. We need more cofactor B vitamins to make healthier cells. We have to eat well to make the phospholipid fatty protein layer of the cell. Many of us are not eating enough proteins and fats. Our minerals have to be involved to have the iron in the middle of the hemoglobin molecules. So A type blood people tend to have uh, more of the red blood cell larger sizes because they don't digest well and they don't absorb their minerals as well. And so they will have problems making their B vitamins and making blood cells as they get older. A mean corpuscular volume of 100.5, the size is just barely increased. That's extremely early on. And in my 45 years of practice, I don't think I've sent but one person to a hematologist, a specialist in the blood, uh, for a enlarged red blood cell count. It's so extremely slow. It's such a um, manageable by taking a methylated B complex and a good multimineral, and just have your A type blood people take digestive enzyme with betaine acid, hydrochloric acid, and have all your older people, no matter what their blood type, all start taking the same digestive, at least by the age of maybe around 60 with their meals. Um, she went on to say, following the Tustin Longevity lifestyle protocols with addition of K-Force, Vitality C, B12, folate, and iron for low normal ferritin, may try using digestive enzymes since I'm a blood type A. Any thoughts? Yeah, you should. You should. I would have thought if you're my patient, I would have had you on that by now. Nancy says, how best to treat reflux where there are no outward physical symptoms such as heartburn? Yeah. Well, I would just assume the older you get, you're going to get reflux and digestion fails. The food stays in the gut longer and longer in your stomach. It isn't released into the duodenum. The pyloric sphincter is waiting for your stomach acid to get low enough for it to have the signal that it's been exposed to enough acid that it's unlikely any bad bacteria, viruses, worms, protozoa, parasites are left. And then the duodenum opens and the fluid is the chyme, the liquid digestive food is led into the stomach for digestion. The older you get, the less acid you make, the more ineffective your digestion is, the more likely you're going to have worms, viruses, bacteria, all this kind of foolishness, unless you take digestive enzyme. And so we say stop eating late. The way to effectively treat reflux is understand research has been done worldwide, multiple centers independently, large numbers of people studied who are over 60, and they say stop eating around mid-afternoon. Don't eat much past 3 o'clock in the afternoon. Number two, the research, newer and less well established, but very compelling, is all of us should raise the head of our bed 15 to 20 degrees from middle age on. And so I raise my head of my bed. You see, I'm tense in my stomach. I have increased intra-abdominal pressure as I'm talking. I feel like I'm pressured to get all the questions done in time. And I ate around 3 o'clock, and I'm still feeling that food is trying to burp up in me. And most women who have had children like I have, you're going to have strain on that esophageal stomach sphincter, because during your pregnancy, you put a great strain on that muscle there when you had the baby or babies in your stomach, and you had to work and bend over and tie your shoe, and so it would squirt up. So almost all of us who have had children have a weakened esophageal gastric stoma or muscle sphincter there. So it just makes sense to not eat late. The older you get, elevate the head of your bed, and just know the older you get, when you're about 60, just start to use a digestive enzyme that has betaine, hydrochloric acid, protease, lipase, amylases in it. We use here Orthomolecular's orthodigestzyme, and we remarket it as off label. So I have my private label on it, and we call it digestive enzyme. It's the same thing. It's just I can put more in there at a lower price without challenging Orthomolecular as a company having a cheaper product. And besides, I only sell it to my patients, so people just can't call up and get it unless you're my patient. Now, so these are the same enzyme as what I'm pointing out. It has all that in there. And just do that. And that's what I would say would be very helpful. Um, Ron says, which salt is better? Is Hawaiian or Himalayan pink? And can it raise your blood pressure? Thank you. Well, Ron, I'm going to say I don't know that there's any valid, credible study comparing and finances to do a good study on Himalayan and Hawaiian pink salt. The argument there is we have chemtrails that are dumping out heavy metal chemicals, aluminum, barium, strontium. Fukushima in 2011 blew, and we have uranium all over the globe now. We have lead all over the globe. So surface level salt collection is contaminated by the atmospheric environment. So salt that is underground and mined out is typically better. Just historically, it is logically better. And where do you get those salts? I am not able to do everything. I'm not Superwoman, and I buy the Himalayan or the Celtic salt at Sprouts. I know that I want it to be from a mine, but I just don't have the wherewithal to keep up with all the shopping to do it perfectly right. Thankfully, I do EDTA chelation every month to pull out this heavy metal. So that's why I'm not so worried about eating tuna with a little mercury in it or some fish. I'm not so worried about my salt source because I get chelation with it. But I do like these unprocessed sources because there's a lot of trace minerals that we would benefit from. All right. And can it raise your blood pressure? Well, if you don't drink enough water every day, it will. If you don't exercise every day, it will. If you don't watch your carbohydrates, sugars, and fruit sugars, it will. So it's your lifestyle, really, not the salt. We need salt. Salt is very important. And they have demonized salt when really the doctor should be spending time finding out every visit how much water do you really drink? How much exercise do you really do? And how much sugar, starch, carbohydrates are you taking in? That would be more logically impactful for concern about blood pressure. And then John says, do you believe convincing studies are showing that vitamin K2 does in fact direct calcium to the bones instead of to the blood vessels, soft tissue? And my answer is yes, John. I do think there's enough scientific study indicating bone density increases. I have seen this over decades here with my own clinical studies of our vitamin DK2 levels. If we can get them to take their vitamin DK2 and get vitamin D levels close to 90 all the time, then we're going to see those bone densities improve if they're doing their exercise, drinking their water, and enough protein. So yeah, I think even clinically, I've seen this myself. And then let's look for some questions here. Johnson has a question and says, hello, I've been dealing with upper bicep tendonitis for a while. How do I get rid of it? Doesn't want to go away. Well, how old are you would be a question. What kind of routine workout are you doing? What is your job duty? what is your are you doing bicep, exercises all the time? Did you have any prior injury to it? What is your metabolic health like? We have to have, we're going to say 93% of every American has poor metabolic health because of our polluted industrial farming, uh, lying, YouTube lectures, and people on boards who have financial interests and they're not telling the truth. They just want the board they're on from their billion-dollar companies to keep paying them as a consultant. We have corrupted government positions and health departments. So we are metabolically challenged. So to help a tendon repair tendonitis is difficult. It's not hard, impossible. So we have to be seen by a doctor who knows how to do inflammatory marker checks on you, look for foods that inflame you, find out your blood type. If you're an O, for instance, you're going to have inflammation from all the grains that are so common in every food you eat, from cereal to your sandwich to your the crust on your Kentucky Fried Chicken. This wheat grain is going to inflame you, and then you'll never get healed from it. So you have to find a doctor who understands how to use systemic enzymes. Be sure you're drinking half your weight in ounces as a daily intake. So if you're a 200-pound man, you need 100 ounces of water every day. And you need to take systemic enzymes like our uh, Vitalzyme XC, or we market systemic enzymes or Vascuzyme from Orthomolecular. We call it systemic enzymes, private label, so we can give you a cheaper price. These are things we've clinically tested. I helped develop the product. And so you have to have a doctor who knows that if your blood sugars are high and the ranges on the reference ranges are lousy, allowed too high, if you don't have an informed doctor, they're just going to follow the ranges and let you have too high of a blood sugar, too high of inflammation markers. And the sedimentation rate, usually most labs allow you to have a sedimentation rate up to 40. And I only want it to be to 10 for a man. So it depends on the doctor you have. We have great success with our patients, and they live very well and long. So those are some of the few things that I would start to have you look into. And then Mano Apapalai says, instead of pure water, is a mix of sodium chloride and potassium chloride added better for hydration? I'm going to say we have been constantly told in the United States again, because of all the corruption, all the medical school control on teaching you a protocol rather than how to be a scientist and think as a physician. Bought off board members on dietary advisory boards and government position health departments, and they frightened us all about salt. And so we are largely iodine deficient, salt imbalanced, dehydrated beings going around this American type, sad American diet. And therefore, yes, I think it's good to put a pinch of like Himalayan salt into your water. Use salt to taste, and work with your doctor unless you have some heart failure or significant kidney failure disease. And water and electrolyte maintenance is very, very important with potassium. You should do very well with exercise if you do it regularly, with meaning both aerobic and doing resistance training 3 times a week for each of them. And then lower your carbs, drink half your weight in pounds as ounces of water every day. And don't stay up late. Get up with the sunshine, get that beautiful sunshine in, and let your feet stand in the grass, get some grounding, get some electrons from the earth up into your body. And that should go well with your sodium chloride, potassium chloride, and do very well. And see, Johnson also has a question. My inflammation markers were high. Yes. So he was asking the prior question about the upper bicep tendonitis. You got to find uh, not a skilled technician that calls himself a doctor who can do surgical intervention on you. You have to find a clinician who is a real research minded, constantly studying and keeping up with nutritional literature and a broad experience base. You have to find a good functional doctor that will do these things for you, uh, Mr. Johnson. So we hope that that is what we can do. So what I'm going to say now is I don't have any more email questions, and I don't see any other new um, uh, live questions. So I'm going to take that as a little way in which I can get home earlier. I had a long day of work, and I'll take a little extra time off today to get a little freedom. I'll be back here next Tuesday. I probably will also be here, the Tuesday before Christmas and the Tuesday after, just before New Year's. I usually never take a day off in my life. So, but I will take advantage of having a little freedom this time to end a little sooner. So, with that, oh, we have one more question that just came in. Carolyn, I am currently doing a protocol for Lyme disease, which my rheumatologist is prescribing. It consists of herbal tinctures. That's unusual. And I'm proud that your rheumatologist is at least starting now to look at using things like that. The manufacturer says not to mix in a reverse osmosis water. All right, so Carolyn, that's really nothing I can say on that. It depends on what the tincture is. Very often, these tinctures are in alcohol. These herbal tinctures. So I would also want to say, if you have Lyme's, you need to work with your nutrition along with your, either infectious disease or other specialists in this journey you're going on. So go find a good functional physician that can look at your blood type, your digestion, your capacity to oxygenate and do maybe some IV high dose vitamin C, ozone treatments. There are many things that we do along with systemic enzymes that are very helpful to Lyme's as well. All right, I will be back next Tuesday at 6 o'clock, folks. And with that, I'm going to say the Lord bless and keep us and walk by faith, hope, and love. Remember, they will know we're Christians by the love we have for one another. So I have to constantly fight getting old and bitter. So pray for me. All right. God bless you all. See you next week.